Thank you for watching this short presentation provided by the physiotherapists for patients undergoing spinal surgery at St George's Hospital. It will give you advice, a few helpful hints, and it discusses some frequently asked questions. The information in this presentation can be found in the information booklet you have been given at pre-admission clinic. There are three main types of spinal surgery that we see: a laminectomy, a foraminotomy, and a discectomy. Some patients may have a combination or additional components, and this would have been discussed individually with you by your surgeon. If you have compression or pinching of the spinal cord itself or the nerves as they leave the spinal column, you may present with symptoms such as pins and needles, numbness, weakness, and often pain. The purpose of the surgery is to decompress the nerves and try to relieve these symptoms or prevent them from getting worse. Following your surgery, you are encouraged to get out of bed and walk around unless you have been advised not to. If this is the case, you will be told specifically by your doctor or the nurse looking after you. Try to avoid staying in the same position for too long, as you will stiffen up. Try to keep moving between different positions. Please be aware that following lower back surgery, sitting can be an uncomfortable position, so try to slowly build up the amount of time you can sit for. Please be aware that it is completely normal to experience pain post-operatively. This pain will gradually ease over time. It is important that you take regular pain relief to allow you to move and complete your daily tasks and the exercises, as this will help to promote good healing. There is no right or wrong way of getting in and out of bed, but the pictures here demonstrate a more comfortable way. Bend your knees up and put your feet on the bed. Then roll over onto your side, and as your legs come off, push up into sitting. This reduces the amount of pressure exerted on the muscles and can be less painful. The exercise program should be started the first day after your operation. It tends to be more comfortable to start once the drain has been removed. By completing this exercise program, you help to bring fresh blood and nutrients to the area to promote healing. It also helps to prevent muscle spasm, which can sometimes occur as a normal response to pain, and the exercises can help to keep it at bay. It helps to prevent muscle stiffness, encourages good postural awareness, and helps to reduce pain. The exercises are broken down into two sections. Exercises 1 to 4 should be started the first day after surgery. Exercises 5 to 7 should be added into the programme approximately 5 days to a week after your surgery, as the pain is reducing. Lumbar surgery. These are the exercises for patients to complete following surgery to their lower back. Exercise number 1. Lying on your back, bend your knees and put your feet on the bed. Slowly roll your knees from side to side, keeping your body still. Start with a smaller movement and gradually increase how far you can move your knees to each side. Repeat 5 to 10 times. Exercise number 2. Lying on your back with your knees bent and feet on the bed, bring one knee slowly in towards your chest and hold for 5 seconds. Then lower. Again, gradually increase how far you can bring your knee towards your chest. Repeat 5 to 10 times on each leg. Exercise number 3. Starting in the same position, this is a gentle exercise to begin activating your core muscles. Press the small of your back down into the bed as if drawing your belly button to your backbone. You can see this is only a very small movement. Feel your lower tummy muscles tighten and hold for 5 to 10 seconds. Try to count out loud to check you are not holding your breath. Exercise number 4. Sitting in a chair, pull your toes up towards you and then straighten your knee. Hold for approximately 5 seconds. Repeat 5 to 10 times. When these 4 exercises become easy and the pain is reducing, you can progress onto these next more advanced exercises. This is generally about 5 days to 1 week after your operation. Exercise number 5. Lying on your back, bend your knee up towards your chest. This time you're going to resist this movement with your hand. Your leg will stay still and you will feel your tummy muscles tighten. Hold for 5 to 10 seconds. Repeat 5 to 10 times on each side. Exercise number 6. This is a progression of exercise number 3. This time you are going to slowly rock your pelvis forwards and backwards. This encourages the stomach muscles to work a little harder. Your shoulder blades and hips should stay on the bed all the time. Repeat 5 to 10 times. These are the exercises for patients to complete following surgery to your neck. Exercise number 1. Sitting in a chair, take your arms away from your body and stretch them out to the side. For an additional stretch, try extending your wrists back as shown on the video. Hold briefly with your arms out, then relax. Repeat 5 to 10 times. Exercise number 2. In sitting, bring your shoulders up towards your ears and then slowly release and let your shoulders relax down. Gradually increase how far you can raise and lower your shoulders. Repeat 5 to 10 times. Exercise number 3. Slowly circle your shoulders upwards, backwards and then down. Try and move in a slow and controlled way and gradually increase the size of the circles. Repeat 5 to 10 times. Exercise number 4. When sitting in a chair, we often tend to sit a bit slumped. This exercise is to improve your posture. Sit upright in the chair by rocking your pelvis forwards and feel how this improves the natural curve in your lower back, which improves your head position and stops your chin poking forwards. Hold briefly and repeat 5 to 10 times. When these 4 exercises have become easy, you can progress on to the following exercises. This is generally about 5 days to 1 week after surgery. If you have been advised to wear a collar, then start these exercises once the collar has been removed. Exercise number 5. Sitting upright in a chair, gently turn your head from side to side, keeping your chin slightly tucked in. Keep the movement slow and controlled. Repeat 5 to 10 times. Exercise number 6. This is a progression of exercise number 3. Sitting upright in a chair, raise your arms up and take your hands behind your head. Hold briefly and repeat 5 to 10 times. Exercise number 7. Sit in an upright chair with your lower back well supported and your arms resting on your lap. Keep your eyes level and gently tuck your chin in towards you, lengthening the back of your neck. Hold briefly and relax. Repeat 5 to 10 times. Please complete the exercises at least twice a day. They should take about 15 minutes to complete. Do not rush, please take your time to complete them and then you will feel the benefit. Please start with 5 to 10 repetitions of each exercise and gradually build these up to 15 to 20 repetitions over the first week or 2. Use a firm surface and ensure your movements are slow and controlled. It is normal to experience some discomfort, but please stay within a range that is bearable. Do not push into pain, and you will find that your movements will gradually get bigger and easier with time. If you are experiencing more pain one day, then please try not to stop the exercises altogether. Instead, just go back to completing exercises 1 to 4 and then gradually build up how many you can do over time. When can I return to normal activities? You will need to gradually return to your normal activities, but it is very important to pace yourself. Try not to do all your activities in one go. Instead, spread them out over the day and across the week and make sure you plan times to rest. If you try to do too much at one time, you will probably find you experience more pain that evening or the next day, and you want to try and avoid this. Gradually build up the amount you can do over the weeks until you reach your normal level of activity. When can I return to driving? Following surgery to your neck, you must have enough movement in your neck to be able to look over your shoulder when you are driving. Very few patients require a collar, and it may be an offence to drive with a collar, but you would need to check this with your insurance company. Following lower back surgery, you are safe to drive when you can do an emergency stop. You could do a dry run in the car first to be sure. Then you can drive when you are able to sit for long enough. When can I return to work? When you feel ready, but you can consult your GP for further advice if needed. If your job involves long hours of sitting or heavy lifting, you should consult your occupational health team for advice and could discuss a graded return to work. When can I return to exercise and sport? Start with this gentle exercise program for the first week or 2 and try to get out for a walk each day. Gradually build up how much you can do and build up to brisk walking at about 2 weeks. When your wound is healed and dry, you can start swimming. Again, this may be approximately 2 weeks. Please do not start returning to more intense exercise, including running, gym exercises, or sport, until 6 to 8 weeks. Remember, you will need to start gently and gradually build up both time and intensity. If you experience pain the next day, it can suggest that you have done too much. If this happens, then give yourself a few days to rest and let the pain settle, then reintroduce the exercise at a lower intensity and gradually build up. Please refrain from contact sports until you have been reviewed by your surgeon. You may experience difficulty in sleeping for a number of reasons. Pain and discomfort, restricted movement, and your sleep pattern may be interrupted following a hospital stay. Please try these few simple tips to help you sleep well. Take your pain relief before you go to bed. Having a hot, caffeine-free drink in a warm, stress-free environment and reading can often help. Just so you are aware, There are a list of complications in the back of the booklet and advice on who to contact if this situation were to arise. Please remember that all this information is available to you in the information booklet you have been provided. Thank you for listening.